What's up, internet? Today is the day after a pretty long wait, 1 month, as we discussed in the previous video. We are finally going back to the doctor to talk about what comes next. After failing 2 cycles of IVF, we're both a little bit beat down, and I don't know, I feel a little empty, but we're trying to stay hopeful.
I know there's a lot riding on it, but it's all psychological. Just gotta stay in a positive frame of mind.
So we're trying to stay hopeful that there is something else that we can do, but we're on the max amount of medications for these past 2 cycles, so I'm not sure what's really left to change with our IVF regimen. I have written down a couple questions I have for the doctor today, and I'm hoping he can answer some of these questions for us and hopefully give us an idea of what other options we have. I've heard about like embryo glue and assisted hatching and even doing intralipid infusions. I don't know if you guys have heard anything about this stuff, but honestly, I don't know if we're already getting assisted hatching and embryo glue. I don't know if he's been doing that for us or not. So I kind of want to see what his thoughts are today and if he has any idea why this isn't working for us. Other than that, I don't know. I think our plan personally is to do a frozen transfer next, as we've done 2 fresh transfers. And I know we have, I believe, 6 eggs frozen right now. The only problem with the ones we have frozen is they weren't developing quite as fast as the ones we used for our fresh retrievals. He let these ones go until 6 days and then froze them, which is a little bit longer than expected. So I'm not sure if they're good quality or not. He did still grade them pretty high. I think they're all like 4 AV. Or maybe 1 for BB or something like that. But we'll find out a little bit more today. I will keep you updated after our appointment. So we're just leaving the doctor's office now. I think it went pretty well, at least better than last time. I felt like he had more time for us this time when we went.
Got seen right away. That was important.
Yeah, we did. We got taken back right away. He seemed pretty shocked that our second cycle failed, but this time I felt like he had a lot of options for us, or not necessarily options, but a lot of things we could do next.
Yeah, it just sometimes feels like a foreign language that they just get to talking and have all these ideas and plans, and basically at the end of the day it's statistics. I felt like it's not really anything that we could have changed or done. It's just luck of the draw, and our age, 50% of our embryos aren't good to begin with, so just luck of the draw.
Yeah, so he wants us to each have genetic testing done now, so we each had blood work done before we left. And then he wants me to undergo another HSG, which, if you recall, was a really painful test I talked about in a previous video where they squirt saline into my cervix.
You look down in there and the penny's inside the bottle.
Oh!
And check my tubes. Then he wants me to do another test where they do a dye inside of me. And then they scrape my uterine lining and let it thicken or something like that for better chances of implantation. So those are all things he wants to do ahead of time. And then he also wants John to send another fresh sample to a separate company to check for fragmentation, which I don't really understand exactly what that is, but something about.
More basically genetic testing to make sure everything's okay before we keep going down this road, to make sure we're not wasting our time.
Yeah, and then the plan from there is to do another transfer, but this one's going to be frozen. So they're going to take the best 2 frozen eggs we have and thaw them. And then I talked to him, and he's going to try it with embryo glue, which statistically there's been no proven benefit with it, but there's been no harm. So I guess it can't hurt, it can only help. So we're going to try embryo glue this time to see if it will make these little babies stick. And I'm going to be on the blood thinners again, and aspirin, and lots of hormones. He's increased my dose of progesterone, and I'm still going to be on estrogen. So I'm going to be a hot, crazy, fat mess for a couple weeks. But again, they're putting me back on birth control. Today is the 2nd day of my cycle, and so I'm supposed to start taking birth control tomorrow to get things moving. But it doesn't look like the actual transfer will probably be until next month. So I'm a little disappointed in that because I feel like I want this to happen as soon as possible, you know. So it's like every little step I feel like we're postponing things, but we gotta do what we gotta do to give this the best shot we have.
Yeah, he sounded pretty confident, but he was confident last time, so I don't know. We'll see.
But we're gonna go get some food and think about all this paperwork we were given, set up some more appointments once we look at our calendars. But thanks for tuning in again, and continue to follow our journey, and I guess I'll touch base once we're actually getting some of this testing done. Hope it doesn't hurt this bad this time. Alright, see you later, guys. Okay, so I'm getting ready to go in for my HSG. If you guys remember, I talked about it in our 2nd video, I think, that the HSG is that test where they go in and put a balloon in my cervix and then squirt water up into my uterus and fallopian tubes to make sure everything's okay. I had this done at the beginning, like beginning before we even started cycle 1, but my doctor wants me to have another one done just to make sure there's nothing there that could possibly be causing our failure. Going in for my 2nd HSG, hoping that it's normal so I can begin cycle 3. So wish me luck. I may have taken like 2 Excedrin and 2 Motrin in hopes that this one doesn't hurt quite as bad. So I'll check in after and let you know if it is as painful as I remember. So I just got done with the test. Apparently this one was a little bit different than last time. So last time they used saline. This time they used like a dye and then took a bunch of x-rays while they were using it. The first test I had before we started IVF with the saline was normal. They said everything looked good. But today, I got more bad news. Because if everything else wasn't enough, apparently my left fallopian tube is completely blocked. Which doesn't make any sense to me because, like, how do you get a blocked fallopian tube? Well, things that I've been taught throughout my training that cause it are mostly STDs. And I have never had an STD.
You're going to be having a lot of urges. You're going to want to take off your clothes and touch each other. But if you do touch each other, you will get chlamydia.
I've been with the same person for 13 years and I've been completely asymptomatic and never had an STD. I've been tested, actually. I get tested every year. Because, and I've never had one. Other things that can cause it are endometriosis, and I don't have that either. I just think it's bad luck. Like, I have no eggs in the first place. I have a low anti-Mullerian hormone, and now I have a blocked left fallopian tube. I don't know if that makes IVF harder, because to me, it shouldn't. I'm producing eggs, they take them out themselves, and have been fertilizing them and putting them back in my uterus. So I don't think it should make my chances with IVF any less, but it does make my chances of getting pregnant on my own even less. So my doctor had told me I had a 6 to 8% chance of ever getting pregnant on my own. And now with this, I think that chance goes down even lower.
0.0.
So that sucks. I I don't know why it's hitting me so hard, but I just like, I feel like one issue is enough. Like, why do I have to have so many? Getting ready to go home, and I don't know. Hopefully this doesn't make IVF any harder than it already is. So, more bad news for us. Hey guys, I'm just getting ready for work here. I'm not wearing scrubs today as I have a presentation this morning, but don't worry, I'm packing them for later. Today is kind of a big day. I'm a little bit nervous. I have this presentation this morning, and then I work a shift from 3 to midnight. But tomorrow is my big test. So last week I had that HSG test where they told me that my fallopian tube was completely blocked on the left side. But tomorrow I have another test, and it is called a hysteroscopy, I believe. I don't know exactly what they're planning on doing, but the doctor did say that there's going to be scraping of my uterus, and it sounds like I'm going to be asleep for the procedure. I have to take medications tonight while at work. There's one that has to be inserted vaginally at 6 p.m. exactly, and it said the side effects are severe cramping and bleeding. So I'm a little bit nervous that it's going to affect me at work. I'm taking it like they're telling me to, and hoping for the best, but I'm nervous, really nervous. And John can't be there for my procedure tomorrow. He's actually going out of town to New York to visit some friends he went to orthodontics residency with. So my mom and dad are coming up to take me to this procedure as I have to be put to sleep for this, and take care of me afterwards. So I will check in and let you know how it goes with his medication and how my procedure goes tomorrow. I don't know when I'll be getting the results, but hoping for the best here. Okay, talk to you later. So we are getting ready to go in for my procedure. I think it's called a hysteroscopy. I'm not really sure what's gonna happen, except for that they're gonna scrape my uterus. I took that medication last night, and I have had some cramping from it. Not as bad as I was afraid of, but it's not been comfortable. I'm with my mom. Hi! She is taking me today because John is in New York visiting some friends, so I will touch base after. So I told you I was having that procedure, and that was actually yesterday. It went really well overall per the doctor, but when I woke up I was super sleepy. They use propofol to put you to sleep for these procedures, like for both of my retrievals and for this hysteroscopy I had yesterday. But for whatever reason, I just didn't want to wake up yesterday. I woke up, fell back asleep, woke up, fell back asleep, finally was awake enough to eat some juice and crackers and go home. But all day yesterday I just wanted to sleep, and today I'm still really tired. I took multiple naps. Yesterday I had a runny nose like the whole day, so I don't know if I'm coming down with a cold or if it's from my body like fighting everything that's happening, the inflammation and stuff from the procedure. But the doctor said that he did see some webbing in my uterus, which he like wiped away, and then micro polyps, which he removed. So hopefully my uterus has a fresh start and is a good place for embryos to attach to for this next frozen cycle. So as of right now, they did give me my Lupron injection during the appointment, and we're still scheduled to go through with our frozen transfer in the next week or so. Monday I start my estrogen again, and I start patches as well. So I'll be on oral estrogen and estrogen patches, which is probably going to be interesting. Last time I got hot flashes from those patches and headaches as well, so it's probably going to be twice as bad, but it's okay. We'll start it on Monday, and I will let you know how things are going throughout, and hopefully everything goes well in this this frozen transfer. Alright, as you can tell, I'm still sleepy and a little groggy for I don't know what reason, so maybe I'm going to take another nap.